time poor too. So, look, it's a good question. In our practice, we write referral letters back so that they get an update, they being the urologist, and we also copy that to the GP with the patient's permission. So a lot of it falls in the GP's lap, and unfortunately the GP that we've had here tonight had to leave to go home to his family. But the GPs are desperately time poor, and I'm sure as many of you have perhaps experienced with your own GP, you go to the GP and sometimes the GP actually forgets to ask you how you're going after your operation. I've had that happen to more blokes than I can count in the first 2 months. They see the GP says, "Oh, right, how's your blood pressure? Okay, yeah, right, good, okay. Everything else is okay?" And the bloke says, "Well, I'm actually here to talk about my prostatectomy. I remember you picked up prostate cancer." And he says, "Oh, geez, yeah, I'd forgotten, sorry." And you know, so I think it's, to answer your question, that it's really hard to get everybody on the same page. Would that be, that would be true, I think, in most people's work, yeah.
Trouble is, we're all time poor as well. We don't expect to wait for 3 hours of a surgery.
I hear you. And we always talk about the journey, and I hate to say the journey, but we always talk about the journey being patient-centric. But I think too often the patient's not the centre of the decision-making process. And I think that's where your allied health practitioners, be it your nurse, your pharmacist, etc., your physio, your sexologist, etc., can pull it back and put the patient back in the middle, because that's where we need to focus our attention, and that's where we get the outcomes. Any other questions? Paul?
I've got two very different questions. I might just ask one at a time, if I may. First, Maureen, talking about pelvic floor exercises, and you mentioned trying to build up the strength of that muscle, like maybe it's going to end up like a big bulging bicep one day. I just wondered how subtle or how intense those exercises should be. Is there any benefit in really giving that thing a good big squeeze for as long as you possibly can, or is that not to be encouraged?
There's basic, well, put it in sort of a nutshell, there's 3 different ways you can use your pelvic floor muscle. You've got fast fibres, which will twitch quickly and maximally, and they're the really handy ones to activate before you do things like cough or sneeze. You want to build up your endurance to hold, for instance, if you're picking something up or as you get up from a chair. But probably one of the most important things that is, and the research is certainly showing that, is to build up an ability to not tighten your pelvic floor maximally, but to tighten it a bit, somewhere between, say, 30–50%. But you have to hold that for an extended period of time, like for a few minutes, like walking down a flight of stairs, walking down Red Hill or wherever, because that's what will help get your confidence better. It's not the maximum. I mean, if you walk around your hand clenched maximally for very long, it becomes non-functional very quickly. Whereas if you've got it working a bit, it's much more useful to you. Same thing with your pelvic floor works all the time. Before you had your prostate surgery, you had a pelvic floor, and you didn't know what it was doing. It was useful with erections and orgasms and stuff like that. But it was working to some degree, a bit like the lower tummy muscles, as a sort of posture muscle to help support things. So you want it to work a bit more than it used to work, in a slightly different way. You want to try and compensate for the loss of the sphincter, but that's not a maximum contraction. So there's different ways of learning how to do it, and that's where, feedback and input's quite important. You can sort of see on the ultrasound machine when you're doing a maximum and when you're somewhere between the two, and that's what you're trying to aim for.
Dare I say, going health leather can be detrimental.
Yeah, you can overdo it, and you can make your muscle fatigue. It's not very big, it's a small muscle, and it will fatigue, and then you won't work very well at all. So you can go downhill by doing too much too. And I do have to put the reins on people at times. It depends on your personality a bit.
And part 2 of the question?
The other one is, I hope the panel can clarify something that confused me in the discussion. A lot of it revolved around erectile function and the importance of the blood vessels to that function. And then another part of it seemed to revolve around the integrity of, or otherwise, from nerve damage from the surgery. And I'm trying to reconcile those two things with part of the discussion, which was about orgasm without erection. Now, I would have thought that was a signal, or I could be wrong, that there's nervous integrity. So is that indicative of an optimistic indicator for circulation function, which we haven't actually talked about blood vessels being damaged by surgery. So can anyone sort of pull that together for me?
I'll give you the short of the long on blood vessels. Blood vessels are not particularly damaged during the surgery. It's more after the surgery. If we don't do anything to keep them healthy, they become, as Jane said, the penis atrophies and blood vessels become fibrotic, which means scarred, damaged, less stretchy and leaky. So that probably addresses the question around blood vessels. So it's more about keeping them healthy, and taking things like Cialis makes the inside lining of the blood vessel really healthy, so that we can better utilise the oxygen that's coming in into the penis and getting it into the tissue to keep the tissue from dying, if you like, or becoming atrophying, which causes that shrinkage. So we want to keep the blood vessels healthy, and that's about putting blood and oxygen through them regularly, so they don't end up toughened and not working properly. The question around orgasm in the non-erect state, I think, is probably a good one, perhaps for Kim. Do you have much to say on that ability? Do you see that much? Or, I mean, Ian and Jane certainly touched on it. I know in our clinics, and I can't speak for Tim, but certainly the blokes I speak to, there's a good number that can climax without an erection. There's, for some blokes, the ability to ejaculate is actually not possible. So some blokes won't be able to get that, or they might be particularly prolonged in their ability to ejaculate. And that can happen without having had prostate surgery as well, but it can be a direct cause. The prostate surgery can be a cause of prolonged or inability to climax.
Wasn't Jim actually asking that if you can orgasm without erection, is that
an optimistic
indicator that you've got for nerve recovery?
Yeah, I think you could probably extrapolate that data. Yeah. I don't think it would hurt. I think it's a very positive thing, but I wouldn't take it as a direct indicator. I think it tells us that there's an ability for nerve transmission to occur, which is then critical for blood flow and erectile function. But I wouldn't like to extrapolate that data.
Yeah, there's a couple of different types of nerves that we're talking about as well, because the prostate nerves that we talk so much about, either being severed or spared, they're the ones that are able to induce the erection with the blood flow. We've also got the sensory nerves, which are more so when you're masturbating or whatever you might be doing to stimulate that orgasm. The sensory nerves may still be fine, and that would typically be what's causing that feeling.
They're different bundles, so you're saying they're anatomically remote from...
Yeah, different kind of lineage, I suppose. Yeah, it's very complex. So there's retrograde climax, meaning so that's actually an issue with the bladder not closing off properly during the climax as well. So you might be able to get that kind of feeling without the erection or without the ejaculation too.
So it's actually just saying that the actual the climax, the material that's normally ejaculated, actually goes into the bladder, and it gets washed out when you pass urine as well. But also another point as well is that you've got people can actually climax without any ejaculation, so men can climax without ejaculation as well. So there's a lot of different sort of variants on that one, and you can climax, with a erection that's say 40% or 30% or something, less than that. So it doesn't necessarily indicate that it's a good sign, but I'd be taking it as something that's really positive. Yes, I'd be celebrating.
Yeah.
I think, look, to Kim's point, I think we need to look for positives post-radical prostatectomy, and I think the ability to climax, whilst it might not be a direct indicator, is actually a good win. So I think that may not be a direct indicator, but we'll absolutely take that. Ian and Jane, I'd really like to throw to you about just the healthy lifestyle diet, because we haven't covered it tonight, and I think it would be remiss of us to leave the room without just touching on it briefly. So, Ian and Jane, I don't know who wants to fill that, but in terms of, what have you done in the way of lifestyle adjustment? I know you've worked so hard on on rehab and relationship and making sure that we get a good outcome. But is there anything from a diet or exercise point of view that you feel is worth mentioning tonight to the folk here?
They're very obvious, but it's keeping fit. It's very clear to me that if you keep your body fit, your whole recovery from any sort of condition is going to likely be better. And I've always been fit, so has Jane, and we've maintained that. And that requires, again, it's a daily thing. You just have to do it each day. But if you do, you find the benefits are that I think your body works better in general, and in particular if you're doing the other exercises as well. It just all adds to the mix. That's my view of it. The other thing that I have done is lose a fair bit of weight before surgery, and I've kept that off by and large, and that I think again has probably helped I'm just guessing, I'm not medically qualified of course, but it seems to me that helps the body just function better again. So they're the two things that I would say.
You've actually, I think you've done yourself a disservice. You talked about Pilates before, and I think that it doesn't have to be down the gym pumping weights. It doesn't have to be running up red hill. Pilates is a fantastic, and Maureen can talk more about that, but it doesn't have to be really high intensity. Something like Pilates, I think, is stands you in really good stead. So, Jane?
All I would say is that because Ian and I do exercise every day, we're used to it. So for Ian to incorporate pelvic floor exercises and other exercises into his regime was not difficult. But for a lot of you blokes, it won't be, that you normally go out and do particular exercises every day. And we hear from people that we see, we mentor from places who've had surgery. They'll start off with, doing the pelvic floor religiously, but then it just sort of goes by the wayside because life gets busy. But really,
Well, there's a bit of an improvement, and people think, well, that's okay. I'll take it.
yeah, but listen to the great physio here, or who's our physio, happens to it. But she says,
I don't pay them.
you've got to keep doing it, and then you've got to keep challenging yourself. So because if you retrain and you do, particularly for continence, which is the gentleman is gone. He said continence for him it's an everyday issue. So you just don't give up, but you've got to incorporate. It's got to be part of your everyday lifestyle. And that, as Maureen says, the better you get, then you challenge it, and that's the way you've got to do it.
This is again a bit of a personal remark. Jane, and I want Jane to keep the mic actually. Jane and Ian, they work very hard. They're diligent. They're hard. They have good expectations. They're well read. They're well educated. They're seeking advice in the right place. But yet they do enjoy their life still. And I think it's important to note that because they'll go out for dinner, and I'm sure they'll have a glass of wine. And I think the point of all that is that I think it is important to have to enjoy life and to do things within moderation. Jane, do you want to just talk? Because you're not sacrificing everything. You still go out and you still eat naughty things, and you'll still drink a bottle of wine. So yeah. And some.
Yeah,
Never had an erection.
Yeah, of course. I mean, incorporate it into your lifestyle, enjoy yourself. I mean, you've been given, I suppose, a new lease of life. The whole point about getting rid of the cancer is so that you can live cancer-free and you can enjoy yourself. But I think, the regime that you incorporate into your lifestyle doesn't have to be extreme. Just incorporate and enjoy yourself. But as I say, these sorts of things like incorporating exercising, particularly the types of exercise that Maureen's talking about, which will help your continence and sexual function, etc. Just incorporate it into your daily life and don't give it away.
Yeah, great.
Maureen, did you have anything else to add on just general maintenance of fitness with respect to recovery? Or in fact in a pre-operative state, just do what you can to be healthy.
Yeah, I think what Ian said, lost some weight beforehand, as good as you can. Yeah.
So weight loss and doing everything you can. Stop smoking, get your diabetes under control, talk to your doctor about your high blood pressure. All these things are going to negatively impact on your ability to get a good outcome. Good. Any other quick questions or long questions? You want to have that?
There hasn't been any mention of anyone having radiation therapy. I don't know if that's because it doesn't happen very often, or is it something that's an extra consideration?
Well, it absolutely is another consideration, yes. We would see a good number of patients, unfortunately, that go through the radical prostatectomy that unfortunately the PSA might jump a little bit or they might take the urologist might take some extra margins or lymph nodes, and that can be a bit of a telltale sign that we might need to do some radiation. And the difficulty with that is that it can absolutely set back not only your continence and your erectile function, but your general recovery. So it's another stress, it's another point of anxiety. And interestingly, I think it's probably something we need to think about incorporating into further discussion. There's a gentleman that works at the Icon Cancer Centre up at the University of Canberra who connected with me tonight, interestingly, about what he does in terms of radiation oncology. So another conversation in itself, absolutely. Yep. Alison.
On the subject of radiation, while you're talking in this setting of men requiring radiation post-radical prostatectomy, primary radiation treatment can be just as effective at curing the cancer. The difference being, as you said before, you wake up impotent. Those sorts of effects will tend to come on further down the track with radiation. It won't be an instantaneous thing, but a lot of the management of it would be very similar.
Yeah, look, I mean, I think it would be fair to say, as with all things in medicine, there's always, Jane talked about cutting edge, and things are always changing, and regimes are always changing. There was a time where they said you can't have the medication and then have a prostatectomy in particular, but now that's sort of been flipped around. So, we are here. We've all been through had the prostatectomy now, but I think in the not so distant future there's going to be different ways of doing things, and hopefully a more multinodal approach that gives us better outcomes with any luck. So I'll take that on notice, and I think we need to try and incorporate that with the mental health aspect in further forums. Any other questions? I did want to talk briefly about cost. Maureen, can you give the folk tonight just a brief summary as to the CAPS program? Have you worked much on CAPS?
Not a lot. I don't know details about CAPS.
CAPS is a government-funded program, and for men that have had a prostatectomy, irrespective of your income level, you qualify for some funding on the assumption that you have an ongoing issue with your continence. So it's a program.
I actually had a patient who was rejected for that scheme.
I have had that too, and I just keep applying, and inevitably some nice person ticks a box. But it can be difficult. So keep reapplying. So any of your primary healthcare providers, be it your GP, your urologist, I probably wouldn't ask the urologist to time to fill out a 17-page application form. Your physio, I've got a practice nurse that does them for me. I've put my own name to a couple as well. So there's plenty of people that can fill out the form, and you get I'm using round numbers. You get $600 annually from the federal government. Drops into your bank account. You can spend it on whatever you like. With the premise being that you would actually buy your continence garments with it. So it might be, a penile clamp, or it might be, a pair of underwear, like washable absorbent underwear, or your tanner pads, molly pads, those sorts of things. In the definition, it must be, look like it's going to be an ongoing issue, and then it's up to you if that issue comes good to let them know, and they'll stop the payment. So it's an annual payment which is made into your bank account, which is not means tested. It is means tested in some instances if you've just got uncomplicated bladder leakage, then you actually need to have a healthcare card. But for post-prostatectomy, you actually will generally qualify without any questions asked. So that's one of the little cost savers. Certainly from a pharmaceutical point of view, there's ways and means of making what money you have go that little bit further. And I would encourage you to talk to your pharmacist or one of the pharmacists that I work with around how that can be managed. There's Viagra, as an example, has gone off patent, and it went from $100 for 4 tablets down to $10 for 4 tablets. So, as an example, there's generics, and Cialis is going to be going off patent, meaning that there'll be generics of that coming out. But there's also other innovative ways we've got to deliver those medications in a more cost-effective manner as well. So that can be quite substantial over time as well. If you're Department of Veteran Affairs, so if you're a war vet, you often get quite a deal of assistance. Private health, unfortunately, doesn't kick the tin on a lot of stuff, but it's always worth asking the question. You're not taking these erectile drugs for fun, you're taking them for a medical reason, and sometimes they can be quite good and help kick the tin on that. So I would encourage you to take your receipts from pharmacy to your medical provider, your healthcare provider, and ask the question. And if you think you're not getting the right answer, ask to speak to the manager. Some of them get confused between a drug name, that being like a brand name Cialis, a drug name Tadalafil, and it beggars belief that it happens, but it does. So if you think you're entitled and you're not getting anywhere, speak to the next person up. That's about as much as I can give you in the way of tips to save a few bucks. I don't know if Maureen or Kim are across any other tips and tricks, or Tim, in fact. Yeah, good idea.
There is one other way of getting some money back for physiotherapy and some other allied health through what's called a GP management plan or chronic team care arrangement. And that you can have 5 of those a year for physio or other type of allied health. And it will give you, Medicare will then give you, I think it's $53.80 back for a visit.
I don't think they apply to pension card holders.
No, maybe
They're
not.
exempt. Yeah.
Are they? Okay.
Yeah,
Okay.
And to be honest, I think you'll generally find there'll be a gap, and often what's paid for the service and the service delivered there, it's not practical for the practitioner to deliver it for $53. For all these times, it's just not practical.
So what I might do at this point in time is just hand over to the panellists just for one last comment, and perhaps something marginally inspirational to send us out on a bit of a high tonight. It's all been pretty heavy. I know I, for one, will sleep well and probably have nightmares about the stuff we're coming tonight, including injections. So maybe just a positive thought to finish up tonight. We're under no pressure to leave, I don't believe. No, great. So for those of you who want to go home and go to bed, absolutely fine. I'll hang around. I think there'll probably be a couple of us that hang around. So if you do have any particular questions that you wanted to put to us, please do that. And I'm going to grab to the raffle tickets. And in fact, we might wander around. So if you want to buy a raffle ticket, let's do that too. How much are the raffle tickets?
They're $5 each.
$5 a piece. We've got 30 to sell.
Yeah.
So one final thought.
I just want to reiterate the fact that this scene is changing rapidly all the time. These guys have only been previous 3 years, and so much has changed in that time. The cabeject that Ian speaks about that gave him that really painful erection is notorious for giving those painful erections. Some lucky blokes are able to get away with the little or no pain, but there are injections out there that are far nicer and far less likely to give you pain. So just if you feel that something's not for you, then there's almost always another option. So please just ask the question and go down that road instead. And I also want to go back to the fact of you're never going to be annoying us. If you want to send us an email every second day, that's fine. If you want to come into the pharmacy every second day, that's fine too. But never feel like you're being a burden.
I think I just want to sum up and just repeat and say, look, sex is far more than just what capacity your penis has for maintaining an erection or achieving one. Sexual intimacy is a much, much bigger picture, and I think that I just really want to encourage everyone to kind of think outside the box, that it's more than just sexual intercourse.
Not very good at summing up. I guess I would just like to say that yes, you might be doing these exercises for forever, but there are different ways to do them, and if they're pretty boring, then there are definitely different ways to make them more fun and equally effective. And don't give up on them. They will be useful to some degree or another for a long time.
I think all I wanted to say was just probably picking up on what Tim just finished up on. The developments are happening very fast. Keep in touch with your relevant professionals, because it's amazing how much extra help we can get if we just know that we've got someone to go to who can either answer the question themselves or put us on to someone else who can.
And I just wish everybody the best for the future, and reach out if you need help, because there are people here that will help, and it makes such a difference.
Just to pick up on Jane's point there, I think what we'll do tonight, when we finish, well not tonight, I might do it tomorrow because it's getting a bit long in the tooth now. I'll distribute, of course with permission, contact details for Maureen's clinic, Kim's clinic, and you probably know how to get in touch with us, I suppose. But I might just put a little email together so that you've got those people's names and contact details if you do need to get in touch with them. So I'll do that in the next 24 hours. I think it's also worth remembering that Ian and Jane, Maureen, Kim and Tim, they're here in their own steam tonight, and certainly the conversation we've had and the stimulation we've had tonight from them wouldn't have been possible without their time. They run their own businesses. This is their time and their expertise and training over the years. So I think it would be nice to show them a appreciation for their time tonight.
Thanks to you for organising this, because it's given us a chance to open up and ask questions. I think everybody appreciates being invited tonight.
Well, that's very kind, thank you. Look, it's something that we're all passionate about. I felt like I might shed a tear then. That would be the second time that has happened to me over the many years. The first time being when I referenced Michael, that I first met back in 2012, when I did shed a tear and when I heard about his story, his plight, which is similar to all of you folk tonight. So two things now. One, raffle tickets. Two, on your table there's an evaluation form. You can be as complimentary or scathing as you like, please be honest. We don't want this to be our last patient forum. I think that we can deliver benefits to the patients here locally, but also in the wider community. I mean, we're lucky in Canberra, in the metro area, we've got these wonderful people to talk to, but for the people that are in the bush, of which there's a great number, there is a massive gap, and these people don't have the opportunity to seek the advice and ask the questions that we've had tonight. So any feedback that you can give us that might make the night better and more appropriate for yourselves and for the other sufferers and people who are about to go through it would be really appreciated. So on that note, I'm going to wrap up. Thank you for coming tonight. Thank you for your time. Thank you for your questions and for being kind on the panel. Have a good night, and if you want us, come and grab us.